From the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
It's been a month since I laid out a 6-part plan to accelerate the path out of this pandemic. 1, vaccinate the unvaccinated. 2, continue to keep the vaccinated protected. Keep children safe and schools open, which the Gov is doing. Increase testing and masking. Protect the economic recovery and improve the care of the people with COVID-19. We've made real progress across the board. More than 185 million Americans are now fully vaccinated. More than 75% of eligible Americans have gotten at least one shot. Cases are down this past month by 40%. Hospitalizations are down by 25%. We're headed in the right direction if we keep our eye on the ball here. We still have a long way to go.
Hi everyone, I'm Kathy Wyatt. Welcome to the 25th season and this week's edition of Consider This. Our topic, turning the corner on COVID. Returning with an update is Dr. Mark Rupp. Dr. Rupp is a professor and chief in the Division of Infectious Diseases at UNMC. Thank you so much for being here and welcome back.
Thanks, it's a real pleasure to be with you again.
Before we talk progress, I want to take a minute to remember those people who have lost their lives because of this pandemic worldwide. We want to put up some numbers for our viewers. And as we do that, Dr. Rupp, what are you thinking as you see this?
Well, I think the first thing that people need to realize is that we can become numbed to these statistics. 5 million deaths worldwide, 700,000 deaths in the United States. The death of one person's a tragedy, the death of 1 million people is a statistic. I don't know who said that, but it's kind of true. And we need to just keep in mind that each one of those people that we've lost is somebody's mom, somebody's dad, somebody's brother or sister, or somebody that was cared for, was loved. And unfortunately, there's going to be an awful lot of empty seats around the table this holiday.
Did you ever think that you would be part of something so devastating and yet could have been so manageable?
Well, those of us in infectious diseases and public health spend a lot of time worrying about pandemics. And most of us recognize it really was just a matter of time before we had a coronavirus or a pandemic influenza virus that would have huge worldwide impact. I'd sort of hoped that I'd get through my career without one, but unfortunately, we're in the midst of one.
Well, and we are at a place finally where we can see some of that light at the end of the tunnel. Talk about how Nebraska specifically is trending right now.
Well, Nebraska is more or less plateaued off. So, we've seen the Delta surge, and it's just kind of stubbornly hanging on for really about the last month. I think some of the case ascertainment is probably a little bit on the low side because of the difficulty sometimes with getting tests, and that people are choosing not to be tested because they don't want to go through the quarantine or have their kids stay home from school or not be able to play sports or what have you. So there's all these extraneous things going into that figure. But what people need to keep their eye on is the hospitalization rate, because when people get sick enough to come into the hospital, those are true solid numbers that indicate what's going on with the rest of the community. In addition, people can look at the percentage of positivity, which has been stubbornly hanging at a high level. These are the things that tell us that the pandemic is continuing in our communities. And don't get complacent, don't spike the ball early. We still have a long ways to go. There's a lot of COVID being transmitted currently in our communities, albeit come down just a little bit.
Yeah, I'm glad you're bringing that up, because I think when we hear the word plateau, knowing how long this has gone on and how much damage it's caused, I think you've got people, myself included, we've been so hopeful in trying to get to a place where we could kind of breathe a little bit easier. But you're saying, yeah, we need to proceed with caution. I really want you to hammer that home, because we are heading into the holidays, which we're going to talk about a little bit later. But psychologically, this turning the corner on COVID is something people have been waiting to hear.
Well, I think all of us, as we went into the summer, so if you remember back in late June, early July, rates were very low. So here in our vicinity, we had less than 2 per 100,000 per day. Very, very low level of transmission within the community, something that we could take in stride in our hospitals. Now we're at least 10 times higher than that, 20 or 30 cases per 100,000 per day. And even though nationally we're doing better, so if you look at the map, you can see that the rates are down throughout the South, throughout the Southeast, where they had such a terrible surge. But unfortunately, there's other states that are kind of taking over. So up in the upper Midwest, the Mountain West, those places are really having difficulties right now. In Nebraska, if you look at the map, some of our western counties have a very, very high rate of transmission and caseload. And so this is what we're going to continue to see, I think, for some time yet, is, the pandemic kind of tapering off in some places and unfortunately gaining some steam in other places. So we're not out of the woods yet. People cannot get complacent. They need to be concerned about this and continue to be careful.
We can credit vaccines and mask mandates, and I really want you to address those separately, if you would. How are we doing on the vaccination front?
Well, for the vaccination front, we have a ways to go. So the rate of vaccination here overall in Nebraska is a little bit lower than it is nationally. And there's some places, again, out in the western part of the state that are really worrisome because they have rates of vaccination that might be 20 or 30%. This is way, way, way too low to prevent transmission in those communities. Here in the larger urban areas of the state, we're doing better. And so we do have, the majority of eligible adults having been vaccinated. The vaccine is very effective, and it's been proven very safe. It's amazingly effective in preventing serious illness. And still, even after we're talking about immunity waning and the need for boosters, the people who've been fully vaccinated should feel pretty reassured that, if they're immunologically intact, so if they're not an immunosuppressed host, that they're pretty well protected against severe disease, hospitalization, and death. Now, there is data coming out that as the immunity wanes, we're going to need a booster dose, and I think that, all of us have been anticipating that. It's just not real clear exactly who, exactly when. And so, again, vaccine, very, very effective, we know that. Very, very safe, we know that. But there's some things that we still don't understand in how best to use the vaccine, because in the midst of a pandemic, we needed to bring the vaccine out quickly. So we don't really know, what was the best timing between doses, for instance. So, 3 weeks or 4 weeks, well, maybe 6 weeks or 8 weeks or 12 weeks would be more effective. But there just wasn't time to figure all those things out. When do you need a booster? Is it at 9 months, 12 months, 18 months? Again, there hasn't been enough time to figure all those things out. So we're having to sort of self-correct our course as we go. Now, a lot of people in the public misinterpret that, and it's not safe, it's not effective, they don't know what they're doing. It is safe, it is effective, we're just tweaking things as we gather more data.
Oh, that's fair enough. And I want to go back to what you said about Western Nebraska. Is there anything that's being done maybe differently to raise those vaccine numbers at all, or what are your thoughts there?
Well, the public health services in those parts of the state are doing a great job, and they've done a good job in making it as available as they possibly can. Anybody essentially who has wanted a vaccine could have received it by now. And so they're really having to fight that battle of vaccine hesitancy, vaccine fear, to really try to understand why people don't want to get the vaccine and then try to reassure them that it's the right thing to do for all the right reasons. Protecting themselves, protecting their loved ones, doing the right thing to get their community and to get our state and our country over this pandemic.
You've probably been asked this a million times, but what do you see as the greatest fear or concern that people have in getting vaccinated?
Well, I think that there continues to be a lot of misinformation about vaccine safety. Everything from the oddball, gee, somehow this vaccine's got a microchip in it or it's going to magnetize me, to more legitimate concerns. And so, those things need to be looked at carefully, and people need to be reassured that, most of these fears are just not warranted. Again, when you look at the real risk of getting COVID-19 and the real risk of having severe disease, death, hospitalization, or the long-term symptoms, those far, far outweigh the risks that are associated with the vaccine. And let's be transparent about it, that the vaccine doesn't come free of serious adverse events. There's not a vaccine in the world that you can make that claim. There's not a medicine that can make that claim. So it's all weighing the risks and benefits, realizing that the benefits of vaccination far, far, far outweigh the risks of the natural disease.
Okay, thank you. I want to now go to the mask mandate, which was met with some resistance, but it seems to be working. What are you hearing?
Well, masks do work. And I think if you look at the preponderance of data, you'll come to that conclusion. Again, you can find and cherry pick studies that will show different things, but if you look at the overall amount of information that's available, it indicates that masks work in two different ways. Number one, depending upon what they're made of and how well they fit to your face, they really do provide some good filtration of the air. So again, if you're wearing a very poorly made, loose-fitting, cotton mask, it's not going to do a lot of good. But if you're wearing a better made, constructed mask of multi-layers, it does provide some filtration. In addition to that, one of the main ways that it's effective is that it serves as a source control. So if somebody is shedding virus, and you can do that and feel asymptomatic. And that's one of the sneaky things about this disease, is that you can be spreading this without really even knowing it. So if you're wearing a mask, it's going to contain your secretions, contain your droplets, and you won't be infecting others. Plus, it just serves as a reminder, that, hey, we're still in the midst of a pandemic and you still should be pretty careful. So those are the ways that the masks work, and there's plenty of data showing that in communities that have adopted a mask mandate, that they have less COVID. Schools that have, adopted mask mandates have less absenteeism, less disease, less need for closure, less quarantine. So all those things, indicate that masks really do work. Unfortunately, all of these things have been politicized. And, unfortunately, some folks are willing to put, their political views and political gain up against public health. And I wish it just wasn't that way.
Well, I want to remind our viewers about those folks who are working on the front lines, how exhausted and burned out some of them are getting. In fact, some are leaving the profession. When you talk about COVID and that light at the end of the tunnel, and you're one of those professionals, how are people feeling? Do you sense that there's a little bit of a difference now that we might be turning the corner here a bit?
Well, everybody remains hopeful. Truly, the healthcare providers that I'm associated with and lucky enough to work with every day are just amazing individuals. They're incredibly dedicated. They will continue to work as hard as they possibly can for as long as they possibly can. But there is a limit. And so our hospitals were already full. They were already working at capacity. And then you add the Delta surge on top of that. And then there's some fear of maybe adding now an influenza surge on top of that. And it gets to the threshold where things really do start to break down. And unfortunately, healthcare providers are human beings. They have, all the frailties of human beings, and they get tired. They get frustrated. And one of the chief frustrations is knowing that many, many, many of the cases we're seeing now were preventable. If people would have been vaccinated, most of the cases we see in the hospital wouldn't be there.
Our thoughts are certainly with them. I want to talk boosters. You referenced them earlier. But I think there are going to be some questions, as you said, going around who qualifies, what's the timeline on these things, and where can I get one?
Okay, so first I want to differentiate between a third shot for people who need a third shot. So our immunosuppressed patients largely need that third shot as really their priming dose. And then there's the boosters for people who had responded previously to the vaccine and now have waning immunity. And as I indicated, this is one of those things that we're learning more about, okay? We just haven't had time to figure all this out, but we're watching carefully. We're looking to see when do we start to see breakthrough cases and in what groups those are in, and then trying to make some good recommendations for public health. And I think that's what the FDA and the CDC has been grappling with recently. So for the Pfizer vaccine, the recommendations for a booster have come out, so that if you're over 65 years of age, again, your highest risk group, you're in any of those risk groups where they might have a higher risk of a adverse outcome with COVID. So again, those people who are immunosuppressed, have underlying cardiorespiratory disease, obesity, diabetes, you know, the whole list of chronic conditions, they should deserve a booster. And then there's the folks who, because of their occupation, may have more likely exposure. And that's kind of the slippery slope, quite frankly. But those folks have also been recommended to get the booster. Now, this week, we're going to be talking, you know, at the FDA level with regard to Moderna and J&J boosters. And I anticipate that they'll come out with recommendations very, very similar to what we saw with Pfizer for those vaccines. So those people who've been waiting, eagerly hoping that they could get a booster vaccine, hopefully those recommendations will be coming out soon.
Okay, all right. And as long as we're talking flu, we've referenced that as well. So people are thinking, okay, booster, I'm thinking about the flu shot. Talk about how we go about that.
Yeah, so last year we had almost no flu season at all. Saw almost no flu cases in the community and in the hospital. I don't think we can rely upon that for this year. And frankly, we don't fully understand that, but I think that many of the things that we were doing to prevent COVID transmission last flu season, people masking, people being careful, you know, quarantining themselves, sequestering, keeping their distance, all those things would help to prevent any other respiratory virus. So I think we saw less transmission of flu because of that. But having said that, you know, there's a lot of things about viral transmission and viral, you know, just their behavior within human populations that we don't fully understand. So undoubtedly, there's some things that we're doing to the virus, and there's just some things that the virus was doing to us. Now, what we fear for this year is that we will see flu come back, because we have seen some of the other respiratory viruses come roaring back, like respiratory syncytial virus, for instance, this past summer. So we do fear that we'll see a flu season this year, and it makes it all that much more important for people to get their flu vaccine as well as to get their COVID vaccine. Again, hospitals are stressed already. They don't need an additional wave of patients due to influenza to really tip us over. So,
And no harm done getting in both of them.
no, absolutely not.
Okay.
They're very, very much recommended. Again, influenza vaccine is one of the best studied vaccines that we have. We've been using it for decades. It's recommended for everybody over 6 months of age. So it's essentially a universal vaccine.
Okay, let's talk about children's vaccines for COVID. Imminent, coming up?
Well, what we know is that October 26th, the FDA will consider the information that Pfizer has submitted for a vaccine down to age 5. So they'll be looking at that carefully and making their decisions and making their recommendations. I'm guardedly optimistic that they'll find that data compelling, that it'll be effective and it'll be safe. Obviously, I don't have any inside track into that. That's what the advisory committee is going to be looking at very, very carefully. You know, I would assure folks that they won't be cutting corners, they won't be bringing this out unless they're very, very sure that it's effective and it's safe for our kids.
Okay, and there's another piece of news, a pill to treat COVID. What's the story behind that?
Yeah, so it's one of those unfortunate things a little bit with the COVID pandemic that we learn so much about these agents through press releases now. So when there was more time, you know, there would be a peer-reviewed article that would come out in a, you know, first-rate journal, so you would be waiting for this to come out, and then you'd be able to look at the data and you know, really evaluate things. So what we know is based upon press release at this point, and not that it's not accurate, but what we have heard is that there's a medication called molnupiravir. It's a drug that was actually developed initially to fight flu, but then was repurposed for COVID-19. And in a relatively small study, in giving people at high risk of severe disease, they gave this to folks who were within 5 days of their diagnosis. They found that it cut by about 50% the rate of death or hospitalization. So really, you know, very optimistic findings that for folks, again, at high risk of more severe disease, that we're able to prevent death and hospitalization with an oral drug. So right now we have our monoclonal antibody preparations that we can give to people, but those require an intravenous infusion or sometimes some subcutaneous injections. Logistically, a much harder way to give a medication the molnupiravir is oral. So that's the real breakthrough for this drug. I hope that it stands up to scrutiny when the FDA looks at this, and that we'll have one more tool in the toolbox, one more weapon to fight this COVID.
In the meantime, I wanted to ask, are there any other mutations that we need to be concerned about when it comes to COVID?
Well, the variants that emerge is something completely expected. So, this is just viral evolution. This is going to happen. There's a much better system now for keeping track and really discerning when we start to see a variant that comes to the fore. So these are initially called, variants of interest, where you're just looking at them and saying, hey, here's this variant, let's keep a close eye on it. And then there's variants of concern, where there are indicators that they transmit more widely or more easily, or that the disease that they cause is more severe. And then what's really, really worried about is if one of these variants becomes evasive to our immunological protection. So either the vaccine stops working or our natural immunity stops working, and then that's where we're really in a pickle and almost back to square one if that happens.
Yeah, and I really empathize with the medical professionals in that regard, because as you say, this is all happening and you're just trying to keep up with it, right? And to be able to stay ahead of the curve as best you can. Are you seeing anything based on your own research and so forth, anything coming down the pike like a Delta variant?
Well, again, the systems that are in place are really working well now. So, a few months back, we weren't sequencing many of our viral isolates. So now throughout the world and in our own country and in our own state and our public health lab, we do sequence analysis on a certain proportion of the viruses that are just recovered. And so we do have a much better surveillance system for being able to detect these, rather than, just not that long ago, they would kind of burst onto the scene and be able to spread more widely before we even knew that they were in the community. Now, at least we get some forewarning where we see them emerge in different parts of the world or different parts of the country and know what to expect.
Okay, Dr. Rupp, with everything that has happened, with what we're looking at today, and let's talk future a little bit. Living with COVID, what does that look like? And I know you don't have a crystal ball, but I'm sure that that's a question that a lot of people are asking. It is here, it is likely here to stay. What's this going to look like for us?
Yeah, this virus is not going to magically go away. Okay, so it's in the human population. It has an animal reservoir. We're not going to be able to eradicate this. So we do need to figure out how we're going to live with it, and I think we're getting closer to that day. Obviously, the vaccine has been by far the greatest development that we've had, has been able to really prevent an awful lot of illness. Now, some of these other modalities of treatment will also help us to turn this, really feared, potentially lethal disease into something that hopefully will be much more readily treated or perhaps pharmacologically prevented. So those will be the things that will really be able to turn this disease into something that we can live with and we can get back to normal. Again, I would urge everybody to get the vaccine. That's the first big step. And to not rely upon medications. So even the one that we talked about with 50% decrease in preventing hospitalization means that 50% of people did go into the hospital or died that they were treating or that were at the higher risk. So we don't want to rely upon these stopgap measures of catching a disease. I'd rather prevent it. That's always been true with our infectious diseases. So those will be the things that will allow us to turn this disease into something that we can live with, something that we'll be able to really, with a much greater sense of confidence, be able to, to go to our concerts, to go to our movies, to go to our favorite bars and restaurants, go to our sports events, turn our life back to what we all crave so much without, that continued threat, that continued anxiety that undoubtedly everybody still feels.
Yeah, to go to somebody's house for Thanksgiving. I mean, I wanted to ask you about the holidays because here we are in October. We're looking at Thanksgiving and Christmas, but we're also thinking about the flu, and we're thinking about, so we have about a minute and a half remaining. I'd ask you how you're celebrating the holidays, but how would you recommend that we think about that?
Well, number one, I don't have a crystal ball to predict exactly what's going to be going on a couple months from now. In fact, if you talk to anybody who tells you they know exactly what this is going to look like, turn around and run the other direction, because none of us know for sure. But, you know, I think I'm guardedly optimistic that you know, the Delta variant curve is going to keep coming down, that we're going to be in a better place by Thanksgiving and by the end of the year holidays, and that we should hopefully be able to more safely gather. So I guess my advice for people would be to go ahead and make those plans. You know, plan on having a family gathering, but try to remain flexible. So realizing that, you know, I'm going to have to continue to look at the numbers, and if, you know, another variant comes along or the curve starts going back up, I may need to change those plans. And also keep in mind who's on your invite list. So is there somebody that is particularly frail, particularly vulnerable to the COVID-19? And, you know, try to maybe take protective measures for them. You know, if you have people traveling, maybe a test right before you get together would be wise. Obviously, everybody should be vaccinated.
Yeah. Talking with Dr. Mark Rupp, turning the corner on COVID. We have a graphic with more information that we'd like to show our viewers. These are websites and phone numbers that you can tap into for more information. Dr. Rupp, thank you so much for being here. We so appreciate your time and expertise. Thank you. Best wishes.
Thanks so much, and absolutely my pleasure.
Yeah. Thanks to the students who are working so hard behind the scenes, and of course to all of you for watching. As we close, a look at President Gerald Ford's birthplace in Omaha, as seen through the lens of Stephanie Veloso, a junior here at UNO.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
It is the longest-running Omaha-based statewide television program on the air today. Hi everyone, I'm Kathy Wyatt, producer and host of Consider This. Now in our 25th season, we wish to acknowledge those who have made this educational journey possible. Our guests, underwriters, student crews, the Knowledge Network, the University of Nebraska at Omaha, and of course, viewers just like you. Thank you for watching.